right, welcome over everybody coming over from Breeze Stream. I know we got our Hive raid showing up. I see Aunt Jur in the side chat already. And we have our poll going with today's trivia question. So if you know, this is running in both side chats, both the vertical and the horizontal one, and we will give the answer at the end of the show. So be sure to stick around and hear what the answer is because this will show up in trivia at some point soon. So we have the question today. According to some of the more experimental corners of the biohacking world and a frequent topic in metabolic health discussions, which of the following activities is supposedly the greatest sin you can commit immediately after eating a piece of fruit? The options are taking a 10-minute nap, checking your work emails, sitting perfectly still and not squeezing your muscles, or drinking ice cold water. So think about your answers, vote for what you think the correct one is in the side chat, and we will come back to this later on in the show. But this surprisingly is related to whatever the topic is tonight. I know looking at this, people can say, why are we talking about biohackers? But the reason is we are talking about Casey Means today. And if you do not know who Casey Means is, she is currently the nominee for Surgeon General of the United States. And you've probably seen many physicians out online saying that this is inappropriate. And this is actually a huge deal because this sets a precedent for what the standard is of education, of licensure for somebody nominated to be the physician of the entire country, somebody who's supposed to be giving general medical advice to everybody and giving the recommendations like as kind of the figurehead for American healthcare. So this is a huge precedent that could be set, and we're going to go into why exactly we're having this conversation, who is Casey Means, and why is this such a problem? Why can't we just be happy for once that somebody is getting a position of authority in the government? There are many, many, many concerns, and we are going to dive right into these. Oh, and Audrey says one of my senators voted no against Casey Means. Amazing. Love to hear that. And she is still in kind of the confirmation hearing process. I haven't seen any updates since then about how this is going. It sounds like she doesn't really have the amount of votes that she needs in order to secure the seat, but we will see how all of this goes. So let's get into this. I'm going to pull up a few different articles today. So first of all, let's just dive into exactly what the we'll dive into the hearings in a little bit. I have some articles of the dialogue from the hearings, and we'll get into her actual positions in a little bit. So there's kind of two facets of this discussion. There is the side of, is Casey Means academically and professionally qualified? And then the second part of this is, does she know what she's doing? Is she competent enough? And based on her positions on certain public health issues, can she make the decisions she would need to? Does she have the appropriate level of judgment outside of whether or not she has the credentialing? So, first of all, let's talk about what it takes to become a physician in the United States. So, we all know that I'm along this pathway as well, and this takes a very, very long time. But to make this simple, I'm going to share a diagram kind of outlining what all is involved in this. So okay, that'll work. So we have this physician education pathway on the screen. So it can vary between 11 to 15 plus years, depending on what specialty you're going into. But pretty much the start is the same for everybody, that you go to college and you do your prerequisites and you take the MCAT in order to get into medical school, which is then another 4 years. During your time in medical school, you have a few different board exams. Two of the steps of the 3-part board exam to get you your medical license. So after your second year of medical school, you take step one if you're an MD student, or you take level one if you're a DO student. And then after your third year, you take the next round of boards, which would be step two or level two, or both, depending on the situation. And then after that, you kind of put a pause on those board exams and you go to internship. And historically, internship has been done a couple different ways depending on the specialty that you're going into. Oftentimes, for straight through specialties, you'll do internship as part of your whole residency timeline. An internship is just the first year of residency, and that kind of means you are not eligible for an independent license, and you are under a lot of supervision. You're given no seniority status. You are just learning from the ground up, and so describes here as residency is being paid while learning, and you're doing supervised patient care. And so for a specialty like primary care, uh, particularly, we're talking family medicine, internal medicine, pediatrics. If you're doing primary care from those specialties, or if you're doing hospital medicine off of internal medicine, um, you oftentimes are doing three years of those residency programs. If you're doing surgery, they're often between 4 to 7 years. They actually changed it now to where um, they changed it now to where emergency medicine is now requiring a 4-year residency program, which I don't necessarily agree with, but that's a separate topic. But there's some specialties that do 4-year residencies. A lot of surgery programs do 5 years, like general surgery, ENT does 5 years. And then there are some programs like neurosurgery that does 7 years of residency. So it can vary along that timeline, but regardless, after your intern year, you take your final step of the medical licensing examination. So you take step three or level three, and that determines if you can practice independently as a physician. So if you pass medical school and you pass all three of those licensing exams, you qualify for a medical license. But that's not the end of the story, right? So you need that medical license to continue with residency to finish your anywhere from 3 to 7 years. And then after that, there's a couple things that happens. You either just go straight into taking board certification exams. And oftentimes, if you're not going to fellowship, that's your next step. But even if you are going to fellowship, most of the time, you still have to take your board certification exam before you go to fellowship, because that's required to pass your residency a lot of the time. So let's say you want to be a pediatric endocrinologist, you still have to take the pediatric board exam and then go into fellowship and then take the specialty board exam for pediatric endocrinology. So where Casey Means falls in on this, and I'm seeing some comments in the side chat. So Casey Means didn't flunk out of medical school. She graduated from medical school. So she did the 4 years of college, the 4 years of medical school. The question is, I don't know exactly when she dropped out of her residency program. I'm not sure if she completed her internship. I'm not sure if she made it years beyond that. I'm not sure if she is almost done and ready to graduate, but she did not complete her residency training. So she is, by like definition, she is a doctor. She did earn her MD degree, but she is not eligible to practice. And when we look kind of down the line here, even if you are independently licensed, that doesn't mean you're going to get hired for practice. Like that's something that I was struggling with a lot. Like the military will let you practice without being board certified, as long as you can be independently licensed. But in the civilian world, that's really, really difficult to do. So in my case, I've completed internship, I've passed all my licensing exams, but I'm not board certified yet, and I've not completed a residency. So that's why I'm going back to training to finish all those so that I can get a job. And in that case, I am absolutely not qualified to be Surgeon General. I'm not qualified for most jobs. And where I think that our system needs to fix things a little bit, we do have a shortage of physicians in this country. We have a shortage of healthcare professionals in general. So there are some places like Canada where if you are licensed but not finished with your residency training, you can still get hired as an associate physician, which means that it's not to be confused with a physician associate, which is kind of what PAs are being called now. But this is different to where like you can practice as a physician, but you still have to be supervised to some degree. And I think that that would be a great alternative, allowing people who don't get a residency spot to still practice and still make sure that they're being safe and supervised while they're doing that. So, but that's not an available option in this country. So, what happens a lot of times is we see this residency dropout to grifter pipeline, and this is really what scares me about Casey Means and what we're getting into today with her. So Casey Means went into an ENT residency, which is a surgical residency, and it is 5 years. It is not within general surgery. It actually is a separate residency program for ENT, and it's highly, highly competitive. So I mean, she is very highly competitive to get into an MD school, and she is very highly competitive to match into ENT. I don't know what caused her to leave the program, but she states that she was tired of not like medical school not getting the correct education or whatever, and she ended up following her brother's footsteps and going down the functional medicine naturopath route, which if you need to pay back medical school loans, that I guess is an easier way to do it if you're unwilling to pursue additional specialty training. So that is already a very, very big red flag. But that's where um yeah, but that's where we're kind of starting off with all of this. And we'll see kind of in the discussions here some more reasons why what she says is very, very scary, and makes her a dangerous, dangerous candidate for this whole Surgeon General job. I'm trying to pick which article we're going to go through first. Um, I think we'll before we get into the actual Senate hearings, we're going to go into this article here from the Genetic Literacy Project, and also, I guess this is the broader Science Literacy Project. As an article, I trust them as a resource, and they do a pretty good job explaining the context for this. So let me zoom in for you all here. So this was written on February 26th, which was the day after a lot of the articles went out about the um, congressional hearing. But it says viewpoint: the Casey Means hustle, wellness woo opportunism dressed up as medical wisdom. And I like this picture here with all the astrology stuff. But it says, I thought it might be a good idea to try to examine the underlying reasons why so many scientists and academics truly hate Dr. Casey Means, the Trump RFK Jr. nominee for U.S. Surgeon General. And they start off here with a very important point: arrogant opportunism. And this is the reason why I wanted to start off with this article, to hint at like what are the things that she is saying, but like why does the fact that she hasn't completed her training program really, really matter? Like besides the fact that she hasn't completed it and sees herself as eligible for a Surgeon General position. But her most famous declaration is that she learned virtually nothing at Stanford Medical School. Yeah, that's a big statement. You went to one of the best medical schools in the entire country, and you are so arrogant to say that you learned virtually nothing there. Like, okay, sure. They got to say, not a single thing, really. Her statement, relentlessly repeated for impact during a Senate hearing, implies that either she is incredibly smart or everyone at Stanford is stupid. So she has this air about her that she can do no wrong. She is smart. everybody else is stupid. And this is the same mentality that we see from the Trump administration in general. We see it from Trump himself. We see this from RFK Jr. himself. And so the personality really does fit in with everybody else in this administration. However, it's problematic if you are representing a scientific and clinical field that you haven't finished your training in, and you say that I was smarter than everybody else and everybody else needed to learn this, and I learned virtually nothing because I already knew it all. Yeah, Miranda, I agree. It sounds like a statement about herself and not about the school. It sounds like she didn't actually put in the work to study anything. Her generalization tactics, simple solutions, and penchant for hyperbole, I learned virtually nothing, demonstrates how means is not scientific. No scientist speaks like that. They would take care in their choice of words and provide supporting data. For example, I only learned 14.75% of my knowledge from my time at Stanford, excluding external influences like ... So like maybe this would be more reasonable if she said, I learned virtually nothing at Stanford because I had a private tutor that entire time. And so instead of learning from the school, I just learned from my private tutor the whole time. Like that would be an external factor that would influence this. But no, like she is making the accusation that Stanford is not educationally and academically rigorous and that they're not teaching medicine because she didn't learn enough from their program. A genuine scientist would go to a school like Stanford and listen, verify, and see what he or she could learn by attempting to falsify scientific claims. And even if the scientist is a high potential individual like Casey Means pretends she is, the Stanford professor's claims would be scrutinized according to the scientific methodology. They would never be written off as worthless. Absolutely. If you are of such high caliber that Stanford can't teach you medicine, then you should be able to back that up, and you should have the intelligence and capability to know how to demonstrate that in a way that other academics would see as legitimate, right? But she doesn't make that argument. And we are actually going to watch this Instagram video here because this is what she actually said. So I'm going to switch for a brief second. All right, so listen to this statement. And this is from the Senate hearing.
It's not an overstatement to say that I learned virtually nothing at Stanford Medical School about the tens of thousands of scientific papers that elucidate these root causes of why American health is plummeting and how environmental factors are causing it.
Yeah, and so she goes into the root cause thing. So we've heard this statement before. The root cause fallacy, I'm going to call it the root cause fallacy, is what she relies on to say that, like, that's the reason why she didn't learn anything in medical school. And for the record as well, the person sharing this video is Callie Means, and that is her brother, who is the naturopath. So he says, watch this video, what Casey didn't learn at medical school, why we need urgent reforms. And I'm going to get into this in a second. It's stuff that I've already talked about, but just since people here may not have heard me talk about this before, this is how she leads up to this, is the root cause fallacy.
For instance, in medical school, I did not learn that for each additional serving of ultra-processed food we eat, early mortality increases by 18%. This now makes up 67% of the foods our kids are.
All right, so do you have a citation for that, or are you just going to say that? Because I would love a citation. You should know that you need to give citations for that. And I'm not doubting that there are probably a lot of issues with ultra-processed food, right? But here's something that I didn't get into enough detail on when I covered the nutritional guidelines from RFK Jr., and that is the fact that processing and ultra-processing does not have a consistent definition. So this claim that she's making that you're increasing your risk of early mortality by 18% by eating ultra processed food is really hard to actually demonstrate because the definition of ultra processing is so vague and inconsistent among like agencies using this term. So by some definitions, ultra processing may include a sandwich because you're combining like bread is processed, meat is processed, cheese is processed, and even the fact even if you make a sandwich at home, that could mean that if you define a sandwich as ultra processed, then whether or not you get your sandwich from grocery store ingredients or if you milk your own cows and make your own cheese, make your own bread, make like butcher your own meat, they're both still sandwiches. And so by defining a sandwich as ultra processed, then and you include both things, you're diminishing the meaning of what ultra processed is. And we also cannot make any conclusions about like what health risks come from it because those are very, very different sandwiches. So sure, if you want to compare like a Subway sandwich or a Lunchable to somebody's homemade sandwich, I can't get on board with this 18% number. I'm going to need you to do some more, to give some more citations and disclose your actual definition of ultra processed before we can even go forward. So the fact that she's relying on vague terms like ultra processing and the vague term of the root cause tells me that she's intentionally being vague to get you on her side and relying on you to be ignorant of the facts and ignorant of the consensus, and for you to just react emotionally, which is not something that a clinician or a scientist should be doing and should not be making recommendations to the entire country based on those sources of rhetorical arguments. So
Eating. I took 0 nutrition courses in medical school.
right, okay. So here's the thing. I really wanted to talk about this one. So she took 0 nutrition courses in medical school. So I have a couple questions. Number 1, did Stanford offer nutrition classes? Could you have signed up for it? And did you just choose not to take them? If so, that's not the fault of your school. That's the fault of you for not choosing to take those classes. But something else that is very important, there's a misunderstanding of how medical education works, right? So when we evaluate the comparison between chiropractic colleges and medical school, there's a lot of focus on what specific class titles you take and how many hours those class titles were, and not focusing enough on the content of the classes and the rigor of the individual classes, right? So if I say that a chiropractor took anatomy and med students took anatomy, the level at which they took an anatomy class could be very, very different. In the same way that if you get an associate's degree in biology or something similar, the level of anatomy you're going to get from your associate's degree is going to be way different than the medical school level. Same thing if you take a physics class in high school. That's not the same thing as taking a physics for majors class or a physics for engineers class, right? These are completely different. And even then, at the undergrad level is going to be very different than the graduate level. So, so something here, we have to be careful about the rigor of the classes we're talking about. And in medical school, a lot of topics are covered under bigger umbrellas of classes. So you don't have, like, if you separated out classes based on every individual topic, you'd have like at least 20 classes a semester because you'd have your nutrition class, you'd have your immunology class, your microbiology class, your anatomy class, physiology class, neurology class, nephrology class. You'd have all these separate classes. But what happens in reality is these are combined down into longer duration of kind of all the similar topics. So it's all packaged under well, I mean, they're done in a couple different ways. Some schools are more traditional in that they do a like subject delineated class schedule, which is how my school was, where you have anatomy is a class, physiology is a separate class, pathology is a separate class. And then there's another model which is systems based, where you cover in units based on body system. And so in your cardiovascular unit, you cover all of the anatomy, physiology, pharmacology, pathology of the cardiovascular system. And then you do all that rinse and repeat again for nephrology. You do that again for psychiatry. You do that again for like all the systems, right? So if you were to say that I didn't take any nutrition classes, bullshit. You didn't take any by name of nutrition classes, but all of my nutrition, or at least the majority of my nutritional education, came from my biochemistry class, because that's where you learn a lot of the foundation of how do vitamins work? How do nutrients work? Why do you need these ones? Why do you need this amount of these ones? And I will say that there isn't the same depth of nutrition class that you get in dietitian school, because that's dietitian school. They are experts in that. And we learn enough to give recommendations from a physician side of things, which, yes, is less than a dietitian. But to say that you didn't take nutrition is completely disingenuous. And like similarly, my like neurobiology, neurophysiology class was all under the umbrella of anatomy. So we still took that class. It was just not a separate midterm and final. It was lumped in with my anatomy midterm and final, if that makes sense. So don't be confused if somebody says, I didn't take this class in med school. Okay, you didn't by name, but you did by subject. So this is relying again on ignorance to push her point.
I didn't learn that 82% of independently funded studies show harm from processed food, while 93% of industry-sponsored studies reflect no harm. In medical school, I didn't learn that 95% of the people who created the recent USDA food guidelines for America had significant conflicts of interest with the food industry.
I don't doubt that there are conflicts of interest. I need a lot of citations. I think she's just going to go through more and more things that need citations. We're going to get into some more of her specific viewpoints on things, but I wanted to highlight that her rhetoric in all of this is not honest. Like, she is deliberately blurring the lines so that she can make claims about why she's a better candidate than an actual licensed and board certified physician with experience. So getting back to this article here, and I apologize, I am getting over a cold this week, so if I sound a little off, that is why. So they go on. When means then jumps to the same absolutes and superlatives on how our health has been affected by this chemical or that food ingredient, members of the scientific community just roll their eyes and move on to something more important. That is, before she became the nominee for Surgeon General. Means is not seeking approval from the scientific community. She is an opportunist with an agenda and a yearning for retribution on for how the medical establishment has apparently failed her mother. So she has a lot of emotional reasons to be distrusting of the medical system, but she has allowed that to cloud her logic and cloud her skepticism and make her respond emotionally instead of looking to the evidence. The Means family businesses. All right, so here we go. When Casey Means left the medical profession and joined her twin brother, Callie, on a naturopath crusade, the two opportunists arrived at a circus sideshow with an audience of naive, vulnerable people craving proof of a conspiracy theory. Not only did Means' language and rhetoric change to fit her new fearmonger credentials, she also started touting overpriced products to be hawked as simple solutions. And something else. Okay, before we get too far into this, I thought of another point that I need to mention about Casey Means' medical education and all that. So she's claiming to she's claiming now to understand a lot about nutrition and preventative medicine, functional medicine, what have you. Let's go back to her residency training, right? And again, I don't know how much residency training she had, but she did not train in a primary care specialty. She did not train in anything broad. She did not train in anything that would teach you about nutritional counseling. If you go into family medicine, like in my family medicine internship, we had a lot of lectures from the dietary experts. We had lectures from cardiology, and one of the cardiologists at the hospital has a nutrition background and gave really good talks about Mediterranean diet and whole food plant-based diets, which are both advocated by the American Heart Association and the American is it the College or Association? I always forget with cardiology. The Organization for Cardiology also supports those diets. So if you are in a specialty that is working with cardiovascular disease risk, like you are going to have exposure to that education. Again, Casey Means did ENT. She went straight from medical school to ENT, which is ear, nose, and throat medicine and like primarily surgery, which does not focus, like it's a very specialized niche of medicine that does not focus on primary care. So she wouldn't have that background from her training except for what she learned in medical school from the preclinical years, like what she learned in lectures, and what she learned in like her 1 to 2 months of primary care, or like her I guess maybe might be somewhere between 2 to 4 months of family medicine and internal medicine, which as a medical student, you do not know enough about what that specialty is like. And that's one of the reasons why I'm changing my specialty. But she makes you think that she's gone through enough training to understand that she missed things in her education. No, you chose a specialty that did not involve that education. So stop. Stop crapping on people who actually do learn that stuff in their residency training. Just because you didn't doesn't mean that that is a problem within the medical education system. So I wanted to point that out again as well. Yeah. So in this first paragraph that I didn't really address yet, uh, so she left medicine and then decided to start fear mongering and also started selling overpriced products to be hawked as simple solutions. And if we know one thing that pseudoscientists do very well is they take a very complex, multivariate problem and distill it down to one simple thing that you need to do to make your life completely better. And in this case, Casey Means is talking about nutrition, which nutrition is great. And I would agree. There's a lot of work we need to do in this country about nutrition, but I think a lot more of that has to do with poverty and like food deserts and systematic like systemic oppression, systemic discrimination, and the inability to provide for your family on income that hasn't increased. Meanwhile, inflation is skyrocketing. The social determinants are a lot more important kind of in this case. But no, it's not that complicated according to Casey Means. You just need to stop eating sugar. That's all you need to do. It's that simple. And then if you try this and it doesn't work for you, then it's your fault for not doing it correctly. You're still doing something wrong. And they go on to say no credible scientist would make medical claims that doubled as marketing pitches for gadgets on some online shopping site or offering product discounts for referral fees. Yikes. And here's where it gets very, very interesting. So Casey Means has a couple books, and this is her kind of more interesting one. In promoting her 2024 book, Good Energy, which that name just sounds, it gives me all of the red flags. Like it sounds very Deepak Chopra-y, very food baby. We'll get into what she says here. Casey Means reduced virtually all diseases. Wow. Okay. So she claims to reduce virtually all diseases, including depression, anxiety, infertility, insomnia, heart disease, erectile dysfunction, type 2 diabetes, Alzheimer's, dementia, and cancer to a single root cause: sugar. Yep. So all the diseases, every single disease in the world is caused by sugar, even though sugar is something that you need to survive. No, 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 no. It's because everybody who has eaten sugar, or at least everybody who has had these diseases, has at some point eaten sugar. It's like the same idea that like everybody with lung cancer has breathed oxygen. It's a correlation versus causation argument. And you have a lot of work to do to prove your point here. And spoiler alert, nobody has proven this yet. And I mean, she's so arrogant to think that she is better than everybody at Stanford. So of course she thinks that she is the missing link to everybody's healthcare problems. But the fact that she's not licensed, she's not had any practice of medicine independently, yet she thinks she can do all this herself. And also, in it, like everybody else trying to say that sugar is the root cause of things, because she's not the only one. There are so many grifters doing this, but she is so smart that she determined that like she her way of figuring this out was the most academic and legitimate. So like she's positioning herself as the ultimate authority on this, even though the sugar causes all disease is a very old conspiracy theory that is yet to be debunked or yet to be proven. It has been debunked over and over again. My apologies. The book, of course, the book explains how you don't need doctors to live free from disease. Okay, yeah, you don't need doctors, but you still need to listen to Dr. Casey Means about her ideas. So I guess you need one doctor. Those shills all went to Stanford or some other corrupt institutions. You can achieve limitless health, which that's a red flag too. Simply by monitoring your good energy levels with her handy continuous glucose monitor. Oh my God. Okay, so I think I've covered this in the past that people want constant monitoring of all of their health things. And spoiler alert, blood sugar fluctuates all the time. And we know that to be normal. And if your blood sugar didn't fluctuate frequently, that would be weird and maybe concerning. So to saying that you should be eating food and using a continuous glucose monitor, which are normally used for people with diabetes, and I love CGMs. I think that they are great for diabetics. They replace the need to prick your finger all the time. They I apologize again. But they help you avoid pricking your finger all the time to get your blood sugar levels. You get a more steady monitoring, and you can get a better idea of what your average blood glucose is, and when you're having spikes, when you're having dips, which can also be very important with overnight monitoring and all that. So with somebody that's having issues titrating their insulin to the right levels, CGMs are amazing. Like, and it's an incredible innovation for the field of medicine. But hijacking this technology and saying that everybody needs to use this so that you can achieve your limitless health, and monitor your good energy is ridiculous. And insurance is not going to cover it for that purpose. So you're going to have to pay out of pocket. And you're going to have to buy Casey Means's book, and you're going to have to do her other courses and all that. So you're putting a lot of money on the line for really no evidence-based benefit. Dr. Casey would also like to sell you her 4-week plan to optimally power your cells, as well as a few Casey Means approved good energy cookbooks. Yeah, so here's Dr. Casey's ultimate food list. Choosing to stick to the foods on this list, and there are a lot of them, is the foundation of good energy and great health. If it's not there, my recommendation is to not buy it or eat it. So, or you could stick to something like if you need some guidance, you could, instead of giving her money, you could give a dietitian money to help you um, stick to a diet plan that really fits your life and your goals. Or You could go on something like a Mediterranean diet, a whole food plant-based diet, which are evidence-based already. Oh, or you could just, try to eat more vegetables and try to follow the kind of the previous legitimate guidelines. Miranda, you bring up a great point. Would she and Oz be considered business competitors? Are they going to have public fights over which of their snake oils American public should be buying? That's a great question. That is a fantastic question, and I don't know. I think they would be competitors. And that's a great point. Yes, vegetables will make you healthy. Who would have ever thought of that? Right? Like, this is stuff that we can tell people in primary care appointments. Like, you don't need another person to tell you these things. Unless, of course, you're seeing a dietitian. And in that case, like, let them tell you that. I don't know where to begin to break this down, except that it is horrifying that this is the caliber of the candidate for U.S. Surgeon General. No wonder the scientific community is stunned. Any reasonable person could spot this quackery and naturopath opportunism in seconds. Casey and Callie Means set up a company, Levels Health, to promote their continuous glucose monitoring system, as teed up in their Good Energy best-selling book. Not only do they sell a vulnerable population a monitoring gadget, $199 a month, which that's a lot of money per year. Let's keep a running tally. So we got $199 a month for the monitoring. You have an app membership that's $40 a month. And then dietitian support via an external partner and further blood work options, which is $99 per lab analysis. So that might be like once a quarter or once a year. So I won't multiply that one by 12, but we multiply this by 12. We're already like with the monitoring gadget and the app membership, we're already at $2,868 a year. And then you add in the lab analysis, and let's say you do it 4 times a year, and you're already at over $3,200. And so somebody who already can't afford to eat the things at the grocery store that are healthier, right? Like, my position on a lot of this is social determinants of health and the fact that people live in food deserts, or people do not have an income to support purchasing healthier options. Right. So if somebody can't purchase the healthier options anyway, and you're taking $3,200 from them every year, that's a big issue. And that's going to further take away their ability to actually do the right things. So if Dr. Casey Means actually cares about people following her nutritional guidelines, why would you rob them of more money? It sounds like this is more catered to rich people who can afford this stuff and who can afford vegetables anyway, and who probably are eating healthier anyway, because apart from Trump and his administration, because we know that they're still eating McDonald's like all the time. But how is this helping anybody? This is absolutely a cash grab and nothing more. By selling an app, Casey claims that makes her a tech entrepreneur. Wow. Wow. So she would like really be under like health and lifestyle entrepreneurship. But she's claiming that because she has an app that makes her a tech entrepreneur. Absolutely not. This lady is so arrogant. It boggles my mind. On her personal website, Means also acknowledges she's an investor in Zen Basil and is constantly advising followers to buy their product, recommending the organic basil seeds in her book and recipes on X and on YouTube. Without disclosing her financial interests, some, at least in the scientific world, would consider her rentless referral fee activity as unethical. Absolutely. At minimum, it would be unethical. The Means twins also set up a business called True Med with other partners that cater to the affluent wellness movement, selling everything from home saunas to supplements to Pelotons to mattresses to cold water plunging tubs. Read her book. It'll all make sense. No thanks. I don't really want to. The True Med website touts how all of their merchants can provide a letter of medical necessity within 2 minutes after a short online health assessment, thus saving the consumer up to 30% on their products, because nothing screams medical necessity more than a home cold water plunging tub. which if I needed a cold water plunging tub, couldn't I just fill my bathtub with some cold water and some like $2 bag of ice from Walmart or a gas station down the street? Like, why do I need this expensive tub if the whole concept is that you're doing a cold water plunge? Like, why does it need to be this expensive? Oh, wait, it does because she needs the money from it. As long as people are promised unlimited health by someone going by the name of Dr. Casey, are they willing? They are willing to continue spending on her products and gadgets. How much more will they spend once she becomes Surgeon General? Yeah, so this sounds like a big business deal for her. And if there's one thing we don't need any more of in this country, it's business people trying to profit off of the citizens of this country. We do not need that. And it's the last thing we need for public health. Scientists are watching these clown show scammers in disbelief. Soon, Casey Means will become the chief medical doctor for the United States. According to the U.S. government, that means the mission of the Surgeon General is to give the public the best scientific information available on how to improve health and lower the risk of illness and injury. Yeah, so she's not capable of doing that. Upsetting the Washington apple cart. Casey Means also represents a shift in the DC landscape. The Capitol has been defined by the shifting sands of political fortune. The White House, for example, employs around 1,500 staffers tied to the party in power until recently, either the Democrats or Republicans. Some insiders tell me that it's more like 50,000 White House staffers, but I look more at the immediate posts. When administrations change, the losing party is left in the wilderness, exiled for the next 4 to 8 years to meager jobs in think tanks, consultancies, and foundations until the pendulum hopefully swings back in their favor. The checkered CVs of Washington insiders is always an interesting light read, and needless to say, these political narratives can achieve a lot in the off-season. When the first Trump administration came in, there was no real transition because no one, literally, had expected him to win. Trump 2.0 is a different story. Now, not only Biden Democrats had to clear their desks and have their ongoing projects suspended or canceled, but traditional Republicans found no opportunities in the new administration. Then Doge happened, RFK Jr.'s mass firings of the HHS, and his purification and the Maha movement and all that stuff happened. Kind of go into a bit more of that. So, yeah, we don't need to go too deep into this because we're well aware at this point of how Maha is absolutely not making America any healthier and is a complete joke. So let's move on a little bit to talk about what she actually said during the hearings. So this is a wild ride. So buckle up, folks. It's not that one. It's this one. Okay. So this is from the Health Policy Watch, Independent Global Health Reporting. So this is journalism from a scientific perspective and specifically from a public health perspective. Am I still a resident? I am. So I've been practicing as a GMO in the Army until I got out of the Army, and I am applying for another residency position. So I'm not currently practicing in between residencies. But I will actually find out next week where I'm going to continue my training. So, but I do have two medical licenses in two different states. So I am licensed independently in Virginia and in California. So, but what I can do with that are pretty limited at this point. All right. So let's get to the part where the senators grill her on different subjects. So on vaccines, both Republican and Democratic senators thoroughly questioned the nominee on her stance on vaccines, which the Trump administration has come under fire for casting doubt on a variety of vaccines, and for its response to a wave of measles cases in South Carolina and Texas. Means fielded terse questions from the Help Committee chair, Bill Cassidy, saying she would not use her platform to urge parents to have their children vaccinated against life-threatening diseases. And she justified this by saying, I'm not an individual's doctor, and every individual needs to talk to their doctor before putting medication in their body. Means said, I absolutely am supportive of the measles vaccine, and I do believe vaccines save lives and are an important part of public health strategies. So this is big. So she's dodging this question to try to give two answers at the same time. She's trying to appeal to everybody listening. She's trying to say that she is not in favor of the general recommendation to vaccinate because she wants to get on the good side of RFK Jr. And so she says, I'm not an individual's doctor, and every individual needs to talk to their doctor first, which is an okay stance to have. Like, I don't think it's problematic to say you should talk to your doctor because not everybody is a candidate for the vaccines. However, um, your job as Surgeon General isn't to give individual advice, and that's not what they're asking you to do here. They're asking, would you give a general recommendation to the general public and say the measles vaccine is recommended for the majority of people? Yes, talk to your doctor about it, but you should probably get it. More than likely, you would be appropriate to get this vaccine. So she should be making recommendations like that. But then she also says that, yeah, she's supportive of it, but with discussion. And yeah, okay, anyone that's going to go get the vaccine is either going to go through a doctor's office or through a pharmacy, and either way, they're going to determine if you are an appropriate candidate for that vaccine. You're going to go through that whole intake form. So nobody is suggesting that you get a vaccine without consulting your healthcare team. So that is a dishonest point. They're trying to seem like that any other physician is just going to blindly say, yeah, just do it without knowing people's history. No, they're still going to say, go through your healthcare clinic, go through your pharmacy, and get it if it's appropriate for you, which is what her statement should be. At times, the senators appeared frustrated at Means' response, with Committee Chair Cassidy, who is also a physician, repeatedly asking her if she supported universal hepatitis B vaccination. She says, I'm a doctor and I'm very careful with my words. Yeah, we know you're careful with your words because you're trying to appeal to everybody at the same time. Broadly speaking, I want to reassure you that this is not an issue I intend to complicate or bring an agenda on vaccines. What even is that response? This was a yes or no question. It's like, do you support the policy of universal hepatitis B vaccination in infancy? Like, that's what this question is. And she completely dodges it and says that this is not an issue she intends to complicate or bring an agenda on. Pleading the fifth and like just not answering the question is not good enough when you are nominated to be the doctor for the entire country. Like, you are the figurehead representing what healthcare is supposed to be advocating for. You are the figurehead for American medicine. And you don't have an answer to these questions? There's in a different article I have the specific back and forth pulled up, and this is really interesting. So there's this back and forth on this vaccine issue. Yeah, so Senator Tim Kaine asked, "Do you believe that there's no evidence that the flu vaccine has efficacy in reducing serious injury or hospitalization?" Dr. Casey Means kind of stammers a little bit. Then Senator Kaine says again, "This is an easy one, doctor. This is an easy one." And Dr. Casey Means says, "I support the CDC's guidance on the flu vaccine." Which she doesn't state which CDC. She doesn't state if it's the CDC before RFK Jr. or the CDC after RFK Jr. because these are different statements. And she's just appealing to the CDC. Well, if you're the Surgeon General of the United States, you're kind of speaking on behalf of the CDC, but you should know what the CDC says. You should be able to articulate specifically what that is, and you should be able to answer the question that the flu vaccine has efficacy in reducing serious injury or hospitalization, which is the goal of vaccines. And there's this argument in the anti-vax community trying to say that, well, the flu vaccine doesn't prevent the flu, therefore you shouldn't get the vaccine, or the vaccine doesn't work. Well, that's not the point for a vaccine for a very rapidly spreading virus, right? Like the COVID vaccine, the flu vaccine, the intent of those are not to completely prevent transmission. The goal is to reduce injury or hospitalization, reduce symptom duration, reduce complications. So this question by Senator Kaine is intentional, trying to get at, like, do you ascribe to the actual purpose of this vaccine? And she can't even answer that. And she says, I support the CDC's guidance on the flu vaccine, which is a non-answer to the question about whether or not it's efficacious in reducing injury or hospitalization. And you should know the answer to this question. I know the answer to this question, and I'm not fully trained yet. And yet she's over here claiming she learned nothing from Stanford and that she can be Surgeon General of the United States. And I know this better than she does. Yeah, and that's kind of the gist of that particular line of questioning. Okay, yeah, so then back to the hepatitis B stuff. So Senator Murkowski also pushed back on Means' comments, highlighting the fragile victory of fewer hepatitis B cases in her home state of Alaska, especially for Native Americans. The vaccine has made a remarkable difference in Alaska, the senator said. The other states look to us as an example. You have expressed skepticism about the Hep B vaccine for newborns, and I need to try to understand your thinking on that, given the medical consensus that the vaccine prevents this serious liver disease and liver cancer. Additionally, Means left the door open to the question of the connection between vaccines and autism, which leading medical and scientific institutions have roundly debunked. She also says, I also think that science has never settled. We should not leave any stones unturned. Means said in response to questions from Cassidy. Which is a horrible line of thinking because, again, it's believing the conspiracy before there's any evidence and just assuming that all conspiracies have merit before there's evidence to back them up. So, like, we shouldn't be even considering that unless we have evidence. We don't have any evidence of that. So why are we bringing that up as an equally valid alternative to the medical consensus? And that is dishonest. She should not be saying things like that. And it shows a backwards thinking of the scientific method. Like in that case, we should just believe everything has equal validity until we can definitively prove it false. That's the same thing with religion. That's the same thing with, like, I don't know, what's something we don't know. Like, I mean, even just going with Russell's teapot, like as the usual example of this, I cannot definitively prove that there isn't a teapot orbiting in space somewhere. So therefore, I just have to believe that it's true. That is what Casey Means is doing here. She does not have the logical capabilities to do this kind of job if this is how she's going to answer questions. All right, her stance on birth control and pesticides is another great one. Questioning regarding her views on birth control and the pill used to induce abortions, mifepristone, was equally tense. And yes, I need to finally do my part 2 on abortion, talk about medical abortions, because we kind of did an overview of abortion previously, but I need to cover this one in detail. Means who historically is highly critical of birth control and the negative side effects it has for women with comorbidities, has said that oral contraceptives should be accessible, though patients should have extended and thorough informed consent conversations with their providers. Similarly, she said, I think every medication has risks and benefits. All patients need to have a thorough conversation with their doctor and have true informed consent before taking any medication in response to questions about the abortion pill. Which I agree, there needs to be informed consent. But again, she is sowing doubt and assuming that this isn't happening. She's asserting this idea that people are just getting abortion pills without having proper counseling from their provider, which is not true. If we think about it, what are two aspects of healthcare that are kind of the most like helicopter supervised right now? It is abortion and transgender care. Those are the two that you have to justify every single step. And even if if you're using like if so abortion is an extremely safe procedure and way more safe than pregnancy, and especially way more safe than delivery delivering a pregnancy. So but there's so much helicoptering over abortion clinics because of the propaganda saying that this is unsafe, that abortions cause cancer, that they're not doing true informed consent, like all this stuff. So, hearing from abortion providers and saying that they have to, like, even during very safe procedures, they have to keep continuous monitoring. Like, they have to keep a pulse ox on them at all times throughout the procedure, even though there's really zero risk of oxygen related complications. Like it's a procedure on the same level as like getting a toenail removed at your primary care or getting like a skin biopsy at your primary care. That is like they're very minor procedures and you do not need continuous monitoring through them. And even it's a procedure on the same vein as a pap smear. Like, do we need in like continuous monitoring of your oxygen status while you're getting a pap smear? No. No, we do not. That would be absolutely ridiculous. But they have to do that for abortions because if they don't, there's such a higher likelihood of people raising issues that they didn't follow all these very, very specific steps because of non-factual concerns. And that's the same thing with transgender care, right? Like there's so many hoops you have to jump through in order to get gender affirming care when you could get that same care being a cis person and not have to do any of that stuff, right? Like you can get a breast reduction as a cis woman and no one's going to bat an eye at it. But if you do that as a trans person, now you have to see a psychiatrist first. Now you have to have like 3 letters, or at least 1 letter in some of the better states. But like these are some gates that do not need to be kept. And in gatekeeping like this, number one, it puts further like if I get I don't want to say skepticism because skepticism is a good thing, but it puts further like distrust in in abortion providers because now like by it's kind of begging the question in a way. It is begging the question fallacy and saying that, well, I think that they should allow for these things, but they just need to have we need to confirm that they're doing like a true informed consent conversation before taking the medication, implying that people who are getting these medications and people who are prescribing them are not doing a true informed consent. So it's both like a begging the question and a poisoning the well kind of at the same time. Um yeah, so that's pretty bad. But also in addition, as you add more and more steps to this, like in order to document that they've done these things, more stuff like, obviously goes into the note, and it also adds more things onto your bill that goes through your insurance. And it's going to increase the costs for people. And so a lot of the people that are in need of like abortive medications, like are going through Planned Parenthood, or they're going through some organization that will provide care without insurance. And it's already going to be pretty expensive for them. And so you're limiting the ability of poor people from getting access to this care. So harmful on multiple levels. And if she actually knew enough about public health to make recommendations for the general public, she would have thought through how this is going to impact people in the community. Senators on both sides of the aisle raised questions on Means' focus on pesticides, with Republican Senator John Husted of Ohio revealing a picture of an insect-ravaged ear of corn. So this is the same rhetoric that we get from the Monsanto glyphosate debacle. But yeah, this is the kind of thing that destroys our crops all across the country: corn, wheat, soybeans, fruit, and vegetables. If we fail to use proper pesticides, it will drive down crop yields. And so here's an interesting consideration that we need to make, right? So let's think about this. Let's think about this for a second. Casey Means wants people to eat healthier, wants them to eat more fruits and vegetables, because that's what she believes is going to cure all of your illnesses. But she's also against pesticide use, which we know that organic farming also uses pesticides, and often in higher amounts because they're less effective. And we know that the amounts of pesticides being used on conventional crops are safe, like it's in safe levels to consume. But think about this. She wants you to eat more fruits and vegetables, but she doesn't want you to use pesticides. So then what's going to happen in the market? We're going to have more insect ravaged fruits and vegetables. We're going to have lower crop yields, which what's that going to do to the supply? The supply is going to go up. And this is fun because I'm taking economics right now. And so if we have our supply and demand curves, right? Like if we have a Surgeon General that's advocating for more fruits and vegetables, which I think is an okay thing to do, you have an increased demand for fruits and vegetables. You have more of the population that wants to purchase these things. But we also have, if pesticides get outlawed or discouraged from use, then we're going to see lower crop yields. And so the supply is not going to be able to meet the demand of the consumer base, and prices are going to skyrocket even more. So foods that were already not super affordable are going to become even less affordable. And then what happens when we can't grow these crops in our own country? We have to import them from other places. And what else is happening with imports right now? Tariffs. So people are going to have to pay to import those other goods from other countries. So either way, you're going to have higher prices of fruits and vegetables, and fewer people are going to be able to eat them. So which do you want? Do you want people to eat more fruits and vegetables, or do you want only some people to eat more fruits and vegetables? Which you cannot have both of these things in tandem. You cannot have an increase in fruit and veg consumption and a decrease in pesticide use. And it says Means walking a fine line between staying true to her belief that environmental factors like pesticides are contributing to chronic diseases with the Trump administration's support of agrochemical companies. Yeah, so that's another interesting conflict of interest. So she's in the big organic camp, but Trump the Trump administration supports a lot of the business of agrochemical companies, including the production of glyphosate and which is used in Roundup. So then that's a whole separate debate for another time. But a lot of conflicting arguments here. There are grave issues with these chemicals. I think that we are in a very complicated movement for agriculture and food. We cannot overturn the entire agriculture system overnight. That would hurt farmers and it would hurt food prices. So she acknowledges the fact that it's going to hurt food prices. Yet the Surgeon General nominee also said, a key passion of mine is to understand how the cumulative burden of the exposures we have in our environment across food, water, air, soil, the products we're putting in and out of our bodies, and how these are affecting our health. We know that these diseases are going up rapidly, and of course, genetics have not changed over the past decades. Which I don't know what she means by that. Because genetics does change over time. So I don't know what she means by that. And I will not deny that there are environmental exposures making us sick. But this is... the pesticide issue is not necessarily one of them. All right, so getting into the back and forth between Bernie and Casey Means about junk food. And I already covered my thoughts a little bit on this, but this just becomes a very interesting back and forth. So Means remained true to her critique of ultra-processed foods and the poor state of nutrition in the US, which she says leads to blood sugar issues, infertility, and metabolic diseases. Mental and physical health are unraveling from shared root causes that we can fix. Again, the root cause thing. In her opening statement, Means promised to fight to ban ultra-processed food ads, though she declined to state that healthcare is a human right after being asked by Bernie Sanders. Oh, so this is a fun thing. So she wants people to be healthy, make America healthy again. But she declined to state that healthcare is a human right. So she does not believe that healthcare is a human right. Okay, cool. So yeah, she really is just pandering to the ultra rich who can afford her stuff. Many of the senators agreed with Means and applauded her attention to the issues. However, others like Senators Hawley, Marshall, and Husted questioned the nominee on her commitment to combating the youth mental health crisis, including putting warning labels on social media and stricter age restrictions, which I see some positives with discouraging social media use for teens and young children. But that's kind of a separate issue. They go in to talk about illicit drug use. Yeah, and I get Casey Means uses psychedelic mushrooms, which that's a separate issue. Does it get... we covered a lot of this already. But something that gets interesting in the discussion back and forth between Bernie and Casey Means is that, like, she kind of pushes back on Bernie, saying like, yo, we need to reduce ultra processed food and not make our kids sick and stuff. And Bernie says that he also agrees with that. And I think, broadly speaking, the medical community also agrees with that. But to my earlier point, we have to clearly define what ultra processing means. And we need to make healthy food less expensive. We need to prioritize access to healthcare, because physicians are going to, and dietitians are going to be able to help people learn what foods they should be eating and how to manage their diets. Like, I think that's important, but that should be something accessible to them. Education should be accessible, like going to college, like having options to finish high school without having the need to support your family. Like, those are all ways that could help improve the diets in our communities in general. But that seems to not be the approach. Like, again, you have a person who claims to want to improve health in our country, but then super focusing on the expensive things that people can do instead of making all this stuff more accessible to the majority of people, and definitely like appealing to fallacies that do not actually address the question and not bringing any evidence to the table about this stuff. Yeah, and so she has ties to wellness companies, conflicts of interest. Yeah, so she is an influencer with over 800,000 Instagram followers and 2,000 newsletter subscribers. Means has been a prominent voice in the popular medical space. Her following, along with the popularity of her book and podcast, points to the growing frustration at America's healthcare system and food environment. In her posts on a variety of popular health topics, Means will often mention a sponsor in the wellness industry, including prenatal vitamins, supplements, and other products. Senators picked up on the fact that the nominee profited from these endorsements, though Means pledged to divest any such companies should be confirmed. It does not inspire confidence that you're here to make Americans healthy when you accept money to promote a company who had to pay a settlement because of violating a False Claims Act. Yikes. Said Senator Tammy Baldwin, referring to the company Genova Diagnostics. You made at least $325,000 from promoting supplements since the beginning of 2024, according to information provided to this committee. This includes nearly $135,000 for a so-called longevity supplement, which, if you need a catch-up on the longevity medicine issue, we covered that last week about Peter Attia and his involvement in the Epstein files. But she's a proponent of longevity medicine as well, and that is another big red flag. And $46,000 for wellness teas and elixirs, both of which can cost upwards of $100 a month for somebody consuming them. Yikes. So definitely not about making it affordable. Yeah, and Miranda, good point. Even if she divests, her brother is still involved. Yeah. She's probably going to use her position to promote his platform and still grow the business that I'm guessing they're both part owners of. To Baldwin, Means is preferred solutions to metabolic dysfunctions and the root drivers were unaffordable to everyday Americans and a conflict of interest. But Means reiterated that her role as chief medical spokesperson, she would take on the systemic drivers of America's ill health. I think that we have a monumental blood sugar problem in this country that underlies most of the leading causes of death in the country. Dementia, cancer, diabetes, heart disease, and stroke are all connected to metabolic dysfunction, elevated blood sugar. I disagree. Some of those, yes. But diabetes, heart disease, and stroke, are all pretty connected. Dementia can be connected to that as well. Cancer, no, not really. Cancer is a disease of the aging, and it could be from environmental concerns, but we won't get into that right now. And this is kind of the end of the article. Yeah, so with all that being said, this is really scary. This is who Casey Means actually is. Before we wrap up the episode, I do have another article going more in depth on the hearing about her discrediting of birth control. So let's get into this one. So Senator Murray began her questioning by pressing Means on, here we go, I might need to make it bigger still. There we go. Senator Murray began her questioning by pressing Means on her harmful and misleading statements about birth control, noting that Dr. Means has called birth controls a disrespect of life, claiming that Americans use birth controls like candy, and asserted that hormonal birth control carries horrifying health risks for women. Senator Murray underscored that there are 18 FDA-approved contraceptive methods, both hormonal and non-hormonal, backed by decades of evidence showing that they're safe and effective, and stressed that millions of women rely on birth control every day and deserve clear evidence-based guidance from public health leaders. Senator Murray said, "Thank you, Dr. Means, for being here. Let me start with this. You called birth control pills, and I'm going to quote, a disrespect of life, and said Americans, quote, use birth control pills like candy. You also claimed, contrary to established science, that hormonal birth control has horrifying health risks for women. Now, here are the facts. There are 18 FDA-approved contraceptive methods, both hormonal and non-hormonal, and there are decades of evidence showing that every one of these birth control methods is safe and effective. So I wanted to ask you, help me understand, should women trust the FDA, which approved all 18 methods of birth control after a very rigorous look at the evidence, or should they trust your statement that there are horrifying health risks to birth control, which contradicts that evidence? Thank you, Senator Murray, for your question. I'm curious if you're aware of what the side effects of hormonal contraception are, Means replied. Senator Murray pushed back. I'm curious if you are, with the FDA that went through all of these and rigorously looked at them, or as Surgeon General, if you're going to tell the truth to the American people. So, Means asking, just saying like, well, do you even know the side effects of hormonal contraception? Like, Dr. Means, that is your job to know that. It's your job to know, and it's your job to know that there's a contradiction of evidence in what you're saying and what the FDA is saying. And if you are speaking on behalf of the government, you should know what your government is saying about these. And if there's a conflict, that sounds like something you need to address. She says, I absolutely believe that these medications should be accessible to all women, and also all medications have risks and benefits. And in our current medical climate, with the burden on doctors do not have enough time for thorough informed consent conversations. BS. Absolute BS. And again, I want to say something again here. Going back to what Casey Means' training was in, however limited it was, she was an ENT resident. If there's one thing, one of the many things that ENT does not cover, they do not prescribe, it's birth control. Why would an ENT resident know how to prescribe birth control? That's not their job. You know who does? Family medicine, internal medicine to an extent. Some pediatrics, like adolescent medicine, absolutely does that. And OBGYN. Like, so you're trying to answer all these questions about, and you're trying to claim that doctors aren't having thorough informed consent conversations when you have never worked in those specialties that provide contraception. Your limited experience would have been in medical school in like your month of OB and like your 2 months of family medicine or 1 month of family medicine or whatever. So who are you to say what informed consent conversations OBGYN is having with their patients? I spent many months in both family medicine clinics and in OBGYN clinics. And some of the OBGYN surgeons are some of the most thorough at having those informed consent conversations. Like, the people I learned from how to do proper informed consent discussions, especially regarding birth control, regarding like invasive procedures, all of that I learned from OBGYNs. And this is their bread and butter right here. So stop this poisoning the well of doctors that you never worked with, and doctors and specialties that you have zero, and I say zero, it's like you have minimal training in. And like as a med student, you're really not doing a whole lot of work. Like you're doing more observation, and you're like your patient load in outpatient setting as a med student, as someone not going into that specialty, is like maybe 3 to 4 patients a day. Whereas if you're auditioning for a specialty, like if you're interviewing for that specialty, maybe take 4.5 days. So you just don't know enough about that specialty. Yeah, and Helen just recently had surgery from an OBGYN, and yeah, they're very thorough in how they go over that with you. So this is not true. This is just blatantly not true. Some of the horrifying side effects of birth control that I've mentioned include blood clots and stroke risk in women who have clotting disorders, who are smokers, and who have obesity. Okay. Again, people who are getting birth control are going through a provider who has this conversation with them and goes over these risks. I remember my script that I would go through with people and asking them questions about their history. I would ask them about clotting disorders and bleeding disorders. I'd ask them about their smoking history. I'd ask them about like migraines with auras, etc. Like ask them about things that predispose them to risk from certain contraceptive methods. You sit down and you say, okay, here's what would be recommended for you based on what you want. And that's the other thing. You ask them, like, do you want something implanted? Like, do you want an Nexplanon? Do you want an IUD? Do you want like something oral? Do you want an injectable? Do you want a patch, a ring? Like, here's all the options. Here's what you'd be more eligible for based on your medical history. Here's the pros and cons of all of these different options. Here's the like efficacy and the risk of pregnancy with these different methods. And we have that conversation. So the fact that number one, we're not having informed consent discussions and that we're not going over these side effect risks, like, is BS. And Dr. Means, as someone who's not been trained in gynecology, do you know what risk of those adverse events somebody would have? What is the absolute versus relative risk of these procedures? It sounds like you don't know enough about medicine in general. You're so far removed from the biostats and epidemiology of how to determine what level of risk somebody has. Because, like, let's say, like, if you can say somebody has 15% risk versus a 1% risk of getting a blood clot, that's easier to make the decision. And Means doesn't seem to care about those particular factors. She's just going based on what she thinks she knows. And again, she thinks she knows a lot more. I mean, she thinks she knows everything more than everybody at Stanford. She thinks she's smarter than all the professors and all the students at Stanford Medical School. So maybe, just maybe, Dr. Means, you're Dunning-Krugering your way through a medical specialty that you never worked in. And maybe you should sit down. And Senator Murray asks, so is it general? Is it general? Like, no, it's not general. I'm very careful in general. I'm careful with my words. And when I say those comments, which are taken out of context, I'm saying that about particular women can be hurt if there's not informed consent. Which, yeah, informed consent discussions happen. And then, like, this is just kind of a distraction from the fact that she said birth controls are a disrespect of life. Yeah, and so Senator Murray called her out on that. And it's just great. Saying that is one thing, but saying on, different shows that birth control pills are a disrespect of life is very different. Those are very different claims. And Means says, I'm passionate about women's health and I think it's disrespectful to women, replied Means. Saying people use birth control pills like candy is different than what you just said Senator Murray. Yeah. So she is not consistent in her own position. Yeah, Miranda, I wonder if there could be a defamation case there. I have no clue. Yeah, this is going into her stance on RSV and all that. But I think we've kind of hit the highlights of all this. Oh man, this has been an adventure. So all in all, summing it up, Casey Means is not qualified to be Surgeon General on the grounds that she has not practiced medicine outside of a supervised setting. She does not maintain any medical licenses. She has no active medical licenses. She has not completed a residency program, has not completed board certification, cannot call herself an attending physician, claims she knows more about medicine than anybody at Stanford, and makes very grandiose claims about her level of knowledge and her level of training. And apart from that, has conflicts of interest as far as her social media pages, her affiliate links, her book sales, her continuous glucose monitor sales, all of that. She has some conflicts in her reasoning as far as pesticide use versus people eating the right amount of fruits and vegetables. And all in all, just has poor ethics and poor judgment and is not qualified to be the medical spokesperson for the United States. And granting her this position would be setting a terrible precedent in saying, essentially, saying that medical expertise is out the window, saying that you do not need adequate medical training, you do not need to complete your medical training in order to be one of the highest ranking physicians in the entire country, which is a very dangerous precedent to set. And so I urge people to call their senators or write them something, communicate with your senators, say, I do not approve of Casey Means for Surgeon General. You should vote no. We need to strike this down before it gets any further than this. The fact that she's gotten to where she is now is despicable. We should not have allowed this to happen, and we should not allow this to continue any further. So with that being said, let's get into the quiz question answer for this week. So let me pull up. I have to pull up the one with the answer on it. Share image file. All right, so the quiz question for the week. According to some of the more experimental corners of the biohacking world and a frequent topic in metabolic health discussions, which of the following common activities is supposedly the greatest sin you can commit immediately after eating a piece of fruit? And A was taking a 10-minute nap. B was checking your work emails. C, sitting perfectly still and not squeezing your muscles. Or D, drinking a glass of ice cold water. And the answer is C, sitting perfectly still. And why this is the correct answer is that traditional medicine might just say fruit is healthy. Metabolic health influencers often warn about the glucose spike. The fix, the glucose goddess and metabolic advocates, suggest that if you don't use your muscles, like doing some air squats or a glute squeeze right after eating, you're essentially letting that sugar haunt your bloodstream like a metabolic ghost. So apparently you're not supposed to, apparently eating fruit and not immediately moving is going to cause a problematic glucose spike. And we addressed this earlier. Your blood sugar is going to fluctuate throughout the day, and it is normal to have a postprandial glucose spike. That is not bad. That is normal. Your body is working normally. So with that, thank you everybody for joining us today. Yeah, like one single glute squeeze. Yep, that's going to do it. You will prevent your whole glucose spike with one glute squeeze. But thank you everybody for joining us today. It's been, I want to say it's been a pleasure. It's really not been, none of this. I mean, the show's been a pleasure. The content has not really been a pleasure. I'm still debating over what the next topic for Medical Myths is going to be next week. Join me tomorrow for some Star Wars at 9 p.m. Eastern time here on this channel. And if you want to play Star Wars with us, you're welcome to join us as well. We are looking for some more people. But with that being said, thank you, everybody. Thank you to the channel members, Patreon members, and all you who support us every week. Give a like, please like this video, share it out, subscribe to the channel, and stay tuned for the next one. We'll see you all next time. Bye.